So my name is Michelle Hyatt, and I'm the academic chair of the Enhanced Practice for Internationally Educated Nursing program. Our program is a 2-year Ontario College grad certificate, and it's for IN specifically with a 4-year nursing degree. This really helps position students for success when going to get that visa. We have intakes this year in January and September 2026, and we offer this program full time at our flagship campus, the Dune campus in Kitchener, Ontario. I'm excited later today to give you a sneak peek about what that campus looks like. So, what does our program include? The big pieces of our program is on everything nursing, of course, but a big emphasis on professional nursing practice. We recognize that nursing is different depending on where you come from. So, a big portion of this program is supporting that transition to Canadian practices. There's also clinical skills, assessments, and OSCE prep. Simply put, we're really training people to be strong bedside nurses in Canada. So you'll spend a lot of time in our labs doing head to toe assessments, practicing blood pressures, catheterization, wound care. And it's not because we know you don't come with these great skills, but it's just looking at how we do this in Canada and how we can support you to be successful once you graduate. We get a lot of student feedback and alumni feedback where we hear about what the issues our students face upon graduation. And the biggest thing that they told us about is that successful transition to practice feeling confidence. So that's why we really focus on lab, clinical, simulation time, all of those pieces to make sure you're successful. So again, when I say about picking that right college, we're very proud of the amount of simulation, clinical, and these hands-on experiences we provide students because we know that's what's going to make students successful. So our program aligns with the College of Nurses of Ontario professional standards and entry to practice competencies. That's really important, right? That's going to help you when you go to write that NCLEX exam, be successful. So as I mentioned earlier, it's 2 years and it runs over 4 consecutive terms, meaning there's no summer break, there's no winter break, depending on when you come, which means you're out there working in the community faster. There is 400 clinical placement hours. So you get a ton of Canadian experience and you're getting experience in long-term care homes, acute care hospitals. We have students going to surgical units. One of our students, actually their first day at a small community hospital, ended up helping support a baby being born. So we're going out there and we're doing great, amazing things right off the hop with our students. Students still need to take the NCLEX licensure exam. That's what we have here in Canada. But this program, based on everything that we've highlighted here, really helps set those students up for passing. So I think that's a really great benefit of the college. The last thing I want to touch on is simulation learning. I believe this is one of the things that really sets Conestoga apart. On site here at Dune, we have over 14 bed labs, multiple acute care, home care, and long-term care simulation setups. It's all state-of-the-art equipment. It's all really mimicking what you'll see out there. So you can come here, make lots of mistakes in a safe learning environment before you go out into the hospital or long-term care home. So we have a ton of simulators and mannequins. You can see on the right-hand side, this is actually one of our babies, a very realistic looking baby. Our babies move, they cry, they blink, they do all the things you need to. We actually have a mannequin that gives birth. So very timely to see this mannequin. As the slide says, our mannequins blink. They breathe, their chest rises and falls. You can hear the breath sounds. You can find pulses all over their body. You can take blood pressure. You can hear their bowel sounds. You can, if they're having a respiratory failure, you can actually put airway in them and you can actually do CPR on some of our mannequins. So you can do the CPR, get the feedback to see if you're doing it right. So again, you're practicing here before you go out there. And I know sometimes people say, oh, that seems to be really intense. But we've had students their first shift having to jump in and do CPR. So we're making sure our students are practicing here what they need to be successful when they go out into that environment. This next slide is going to showcase a video of one of our simulation suites at Conestoga. As you'll notice, it looks like a hospital. Down to the signage you see on the outside of the door, right? No smoking, there's oxygen inside, because we do have gases pumped in and out, right? You can take a sneak look here at our facilities and what you would experience here if you come to Conestoga. So this looks like a regular hospital, but actually it's here right on campus. You can see to the right, kind of double way mirror where people can stand behind there and voice over the mannequins. We've got supplies here, just like you'd see in a hospital. You can see we have our medication carts so student can practice to give medications. And this is one of our mannequins sitting here in the bed, waiting for students to come and take care of him. You can see they look very realistic. So again, we can see how realistic our mannequins are. They'll talk, They'll work with you. If they're in pain, they're going to tell you, and you have to move through that process, seeing how you can best support your students. We've got cardiac monitors you can see here on the screen. This next video is actually in our immersive simulation suite. So as you can see, this is a big giant wall that a student is looking at. And this is a game where they're learning how to put on personal protective equipment. And they actually get to select and choose, make mistakes, and do this in an immersive simulation suite where they feel like they're in that real environment. So here they're getting direct feedback right away. Did they do it right? Did they do it wrong? And how can they improve? This is one of our new features, an anatomage table. So this is like a giant iPad, but it actually houses human cadavers. So these cadavers, they've been scanned for science. They've all passed away and donated their bodies. So it allows us to look at all of the things within, inside of them, their bone structure, their heart. This is actually a picture of a heart having a myocardial infarction, right? So they're having a heart attack here. And we can take a look down to that level within the body to see what does that heart look like if they go into AFib, VFib, all of those pieces. Um, how does it pump? The changes might you see? Again, that's going to help that nurse or that student to actually understand what visual changes you'll see or physiological changes you'll see in your patient if they are having a heart attack. So this is just another neat feature we have here at Conestoga College. So by now, I'm hoping that you're hooked and you want to know what is our admission requirements to come into our program. So anyone coming into the program must hold a 4-year bachelor degree in nursing, and they must have English proficiency and registration as the RN in their home country. We find that this is really what sets students up for success as they go to apply to the CNO and helps them be successful in our program. One of the things that I always like to mention to nurses is that there are some new updates here in Canada for internationally educated nurses. So in April of 2025, the College of Nurses came out with a new transition to practice requirement. All INs must take a CNO approved course that has transition to nursing practice in it. These courses range from college to university. It ranges from hours. And the good news is, if you jump to the next slide, that I want to present to you is that this course is part of our program. So within our Enhanced Practice for Internationally Educated Nursing program, we house this nursing transition to practice course to ensure that everyone meets that requirement. So what I might want to mention to students is every nurse that comes into this program may have different requirements to become a nurse in Canada. It's not just a global standard, right? So I always encourage people to review the College of Nurses of Ontario website for details on any changing registration requirements for IENs to come to Canada. And we suggest that you apply to the College of Nurses of Ontario prior to enrolling in the program so you can understand your individual needs to become registered with the CNO and identify any registration steps that you may take to make sure this program is the best fit for you. So while I tell you this program has the nursing transition to practice course that everyone needs, and so that's a fabulous thing, there may be other requirements that some students need. So just double check that to make sure that you have what you need when you're coming to Canada. So what can you expect if you graduate from our program? We have grads working everywhere from Nunavut to Nova Scotia, all over Canada. We're really excited about that, right? Many of our grads are working in ICU, in pediatric units, and right after graduation. There's not that delay, where they are working in units that maybe aren't their preference. Right now, we're seeing students working all over the place. Emergency room. We have one grad that's actually running their own nursing agency with over 200 employees. We have another grad who's the director of care of one of our local long-term care homes. And we have another graduate who's employed working full-time at teaching nursing at our college. So we have grads doing amazing things all over the country with this program. So why should you choose Conestoga College? Just in summary, really it comes down to the high quality program, right? You've seen our simulation labs now, you've seen our anatomage tables, our mannequins, they blink, they do all the really exciting things. You've seen about and you've heard about the 400 hours of industry experience, right? So you're getting that Canadian experience before you graduate in surgical units, in hospitals, long-term care homes, all over the place that you can feel confident when you go out to practice. We have expert faculty that are really engaged and invested in your success. And I think that really sets us apart as well. We have curriculum that supports successful transition to Canadian nursing practice. So while you still have to go out and take that NCLEX exam before you can come registered, we know that this program helps you be successful in that because we've built it to support your success. And as I touched on just recently, is the success for our nursing graduates. Our graduates are out there getting jobs, being successful, they're happy, and they all come back to share that with us. Many of them come back to give back to the community because they're so thrilled to be a part of this Conestoga community and everything we've done to support them. So, in summary, in Canada, it's great to be a nurse. We have a voice here. We get to advocate for our patients. We get to advocate for change, and we truly make a difference. So, we want to invite you to come to Canada, come to the EPIN program, and be part of that joy, that change, because we know that there's a place here for you. Whether you want to work with babies, whether you want to work with seniors, whether you want to work in mental health, there's definitely a home here in Canada for you to work as a nurse. So, please join us.